When it comes to cancer, there's a lot of information out there, and not all of this information is actually accurate. And honestly speaking, misinformation can cause unnecessary anxiety and can even lead people to make wrong health decisions. So as part of efforts to mark this year World Cancer Day, which is today, February 4th, we've decided to do something, compile a list of questions, common myths that people often think cancer is. And I have a guest in the studio who will be doing justice to each of these questions. My name is Doris Mayem-Shishe, and of course, this is Gyna Plus, where we talk about health issues that affect women and girls, and of course, children in society. And this program comes up every Wednesday at 6 p.m. And we always have a repeat broadcast on Saturday at 8 p.m. And an active YouTube channel, Afia Culture and Lifestyle, with all of this health information. Dozens of them are there, so you can check it out. So after the break, you're going to meet my guest. It's a very important discussion you don't want to miss. Please stay tuned. Welcome back. If you just joined me, this is Gyna Plus on Afia Television, a show that talks about health issues, of course, educate women and girls and children on health issues that affect them. And my name is Doris Mayem-Shishe. So before the break, I mentioned that we are marking World Cancer Day. And this time around, we don't want to talk to you about what cancer is not. But there's a list of information or misconception, if you want to put it that way, that is out there, that some questions people often ask, more like frequently asked questions, and then you get to know which is correct and which is not correct. So joining me to discuss that today is Dr. Ngozi Dim, Senior Lecturer, College of Medicine, University of Nigeria, Nsukka, and also Consultant Radiologist, UNTH. It's good to have you, ma'am.
Good to be here.
And you have been here before. I talked about breast cancer the last time, and today we're talking about cancer generally. By the way, you look amazing.
Thank you.
Your birthday was in January, but it's still going as though it's still birthday in February.
Yes.
Welcome. It's good to have you.
Thank you.
Now, like I said, we don't want to do, it's not a lecture series of what we want to call it today. We're just popular questions. So I'll just read a few, and then you respond as they come. So this one is saying, there's a popular belief that putting money or object under the bra can cause breast cancer over time. So a lot of times you've explained on this show what cancer is. Maybe you might want to just briefly say that. But then, while that is coming up, I'd like you to address this, that once you put currencies or some sort of currency note or money inside of your bra, and that it can cause cancer over time. How true is this?
Thank you. It's really amazing how myths seem to, go ahead faster, or people tend to believe them more than the actual truth. So let me say that most of the things we're going to say today in answer to the questions will be basically what is available in the scientific community, because how science works is that they actually rely on facts, not just what you think.
Of course.
So when I'm going to mention these things or try to debunk or confirm whatever questions you might throw, just know that it's on the basis of research that has been done over time.
And that's accurate.
Yes, and that's more accurate than just what we think or what we assume. So for this particular question about putting items under the breast, especially cash currency, yes. So no, there is really nothing that has been able to link that placing these things under the bra or innerwear will have any direct cause for cancers, any form of cancers. So in fact, there are several studies that have tried to say, oh, does this affect it if you wear this, or if you add this, or how you wear your breast or bra, how you wear your bra, does it affect it? And several studies have come up to say conclusively that no matter how the bra is worn, it really doesn't affect if there's an increased risk or if cancer will occur in that individual. Other things might be more important, but how you wear your bra, what you put under your bra has not been able to be confirmed that it has any direct relationship with the cause of cancer.
Nice that you said that. I hope you're getting it, because the information we get here, like you said, is more accurate. So you help, spread the good news and the right information out there. Now, quite linked to that question is, some people say that the metal that's the underwire behind, that it blocks airflow and it makes some women to come down with breast cancer. I know the last time you talked about breast cancer extensively.
Yes, we did. We talked about breast cancer, and all cancers peculiarly, you were talking about being able to describe it. Cancer has to do more with what is happening at the level of the cells. The human being is made up of different parts, different parts have different organs have cells. So the cells is like the minute details within each body, human part. So for breast cancer to occur, there's something that goes on wrong inside those cells. Often they're always linked to one gene. Genes also are important. So once something goes wrong, you find out that cancer, these cells don't die, like they should normally grow, die, that's the cycle, but they don't die. So, and if they are cancerous, they can go from that place where they started into different parts of the body. So with that background now, you will understand that if you wear a bra that has the iron
under it,
it doesn't affect the cells, it doesn't affect the gene. So the chances that it will have any impact on cancer is very, very minimal. Cancer happening has so many factors. Airflow through bra, tight bra doesn't affect that. And like I mentioned, studies have shown that no matter how the bra is, no matter how it's worn, whether things are put inside, not there, iron, all that, that it doesn't really relate to what causes cancer.
Yes, because I recall back then during my uni days in the hostel, once some of my roommates get the bra, what they do is they cut off the iron part, and then so it's a very popular myth, and I'm very happy that you set the record straight. So the iron on the iron beneath the bra doesn't cause cancer. It might cause some sort of discomfort.
Exactly.
And so
pain, things like that if it's too tight, but doesn't have any link with how cancer starts. So people shouldn't be worried about that as far as cancer is concerned.
Now, let's talk about smartphones. This one here is quite a popular concern, that if a smartphone is kept close to the body, in your pocket or in your chest, that its radiation could also cause cancer. Please just, talk to us about this.
I honestly don't blame anyone. I personally had that worry too. I had that and had to do some kind of research to see, is that true? So over the years, you can see how far we've come in smartphone. Technology has changed over a couple of decades since smartphones started coming out. But the key thing is that what generates, because the concern people have is what kind of wave that comes out, what kind of waves. We can't see it, but our phone as it sits has its own kind of waves. So people are worried about that. Unlike waves that are involved in X-rays, which we say can affect the gene in the cells, you see. The waves that come from phones are not really directly linked to any changes. They are not ionizing like X-rays that can cause a bit of harm. They are not ionizing. So that's one good thing about it. And so many studies have been ongoing ever since phones have been evolving to find out there is still no direct link to cause of cancer concerned with these waves that are emitted from the phone. Some people suggested maybe certain things can happen, some cancers can happen, especially on the side that you keep using the phone. But studies really, because it's one thing to do a study with a small number, it could give you some results, but when you test it in the larger population, it doesn't hold water. But when you really want to confirm this causes this, you have to do large population-based studies, and these studies are the more authentic ones. They have not been able to show that direct link, but they are saying that let's be cautious how we use these phones. There's some bodies like WHO, and there's this regulatory body that has defined that the waves from phones, there's a way they coined it, that they are trying to say it hasn't been confirmed, but you never know. So just do things like keep them away from you when you're sleeping. Don't keep them on you for a very long time. Not that it causes the cancer, no, but it's just to minimize whatever effect there may be there. Because one of the effects they've been able to show is heat, increasing heat in tissues. Sometimes you can notice your phone even feeling a bit warm. So that's the highest, if I could say, the most worrisome complication they've been able to determine. But they have not been able to, with several studies that have been done, confirm the link to cancer in the brain or any part of the body from the emission of, from the phone. That's the good news. But they're saying when you use it, whenever you're not using it, keep it in a bag, keep it on the stool. Don't sleep with it don't sleep. People are sleeping and they're putting the phone by the head or by their ear, under their pillow. These are the things they're saying. When you're not using it, keep it because with distance, those waves, the effect reduces.
Okay, so it's a good thing that you said all of these things about smartphones and I mean, caution in all that you said, caution is what one needs to apply. So do not keep it under your pillow. If you're not using it, keep it far off. Whether it causes cancer or not, moderation is very important. So you're still watching Gyna Plus, and we are taking some popular questions, myths and misconceptions that people have often thought cancer is. But today my guest is giving accurate information on that. We'll take a break, and after that we will continue the conversation. Please stay tuned. Welcome back. This is still Gyna Plus on Afia TV, and yes, I still have Dr. Ngozi Dim right here in the studio. So this particular question now is very common. I'll read it. Okay, there's a claim that microwaving food in plastic containers releases cancer-causing chemicals. Tell us, what's the reality?
Okay, so another very pertinent question, because many people are beginning to enjoy microwave. Microwaves, yes, when it heats up food, because the concern here is the use of plastics. That's the concern, to heat up food. Plastics, with research, have been shown to emit some chemicals at the extremities of temperature. That means too cold, frozen, too hot. Too hot, even more concerning than too cold. So when you heat food up in plastics, microwave, the concern is more of the chemicals that are released. But the good news is that the chemicals released often are the ones that cause some dysfunction in hormones in the system, but not that they have been shown to cause cancers. So they're harmful, chemicals released, but the impact is more on hormones directly, but not really directly on cancer itself. So you can say that no, research has not confirmed that it actually causes cancer, but it has shown that some chemicals are harmful and they can cause the way your body responds, because hormones control a lot of things in the body. So what you want to do is to avoid using plastics to warm food in microwave. Use things that are microwave compliant, especially glass, ceramics. Those are much more better.
Okay, so that way it's safe.
That makes
because
it
the convenience
safer.
with microwave is
So it's the plastic that is the problem. Remove the plastic.
I was paying attention because this one is particularly concerns me. I hope the next one I need to heat up my food. I know what I'm doing. But thank you for that correct information. Now, the next one is relaxer.
Okay.
I know we're not talking about any particular type of cancer. It's just these questions we want to speak to. That when you use certain hair product or certain relaxer over time, as women now, that it has a way of causing cancer to the body. I mean, make it make sense to us.
So I think it was last year or last 2 years there was that study. There was this video clip that was on social media. The lady talking about blacks being, a lot of controversies, because who uses the relaxer? It's more of the blacks.
Yeah.
We have the coily kinky hair. The whites don't need it. So the thing with that is that there's always controversy in science, and why is that way is because some people might decide to conduct their research and just do one shoddy kind of thing and tell you, oh, these were the results. But when you really look at the way the studies were done, you'll be able to point out faults. So that's where the problem with that particular claim came from. There hasn't been any study really that is trustworthy to tell us that this is really linked with this. Of course, just like there are chemicals, they could be chemicals, but their worry was that it causes uterine cancers. That was the common thing, the gynecological cancers in women, uterine ovary. But there hasn't really been any study that confirms that. So we can still say it's a controversy. There's nothing that has directly linked it. But if natural is the better, why not? If you can do that, do so.
Of course.
If you can't, minimize how often you use these things, because really, until these things are proven, you can't really say for sure.
How safe they are.
Yes. They are all chemicals. Many of the things can really be harmful.
Okay.
But it hasn't been linked to cancer directly. Yes.
So that still stands out. Hold on.
Yes.
Okay, so we're moving on to another one. That a lot of people say cancer patients should avoid sugar, and that it has a way of feeding the cancer and makes it spread. Is this correct?
Yeah, I've heard that really quite a lot too. I did some little research to see if that is true or not. And like these studies keep saying, high sugar has not been directly linked also, because see, there's something about research. So many research will tell you, oh, it has an association. That means that there's a kind of relationship. Maybe if you take too much of sugar, you find out that those who take too much of sugar over a long time, you have more numbers of that. But that doesn't mean that it causes the cancer. So but what the research is even saying is that the problem is too much of sugar causes things that will put you at more risk for cancer. Not necessarily the feeding the cancer itself and being the thing that will make the cancer spread, but it will also cause a dysfunction in the person's metabolism. It can cause obesity. It can also do a few things that put the person more at risk for cancer. So that's where the problem lies. But there hasn't been able proof to say that, yes, high level of sugar directly causes cancer. Rather, it can do things that will put you at more risk. And that's why the worry comes in. Using of sugar, those cancer cells, they make use of glucose. So even your ordinary food and carbohydrates will still give those glucose. But there's no direct link as of now. Sugary drinks are the worst problems because they cause more of those risks, obesity and all those other things. So you really discourage people from high levels of sugar, but not that there's a direct link.
That this is
that these people, the studies have shown that you take high sugar, you get cancer.
Or once you have it and you take it, it makes it,
there hasn't been all those direct links, but you're just saying minimize it because when you take too much sugar for a long time, it affects the way your body metabolizes things. It's more difficult to function normally. So why even put yourself under that risk? So that's the
I think that makes sense. All right. We are moving on. So today actually is World Cancer Day, and the theme is United by Unique. While you've taken time to answer a lot of questions, I'll ask you one more before we tilt a little bit. Okay. That there's also a popular belief that this one says people believe that once you have cancer and then you have a positive attitude alone, that your cancer can be cured.
So cure of cancer doesn't depend on attitude. Will I say depend, but it's not directly like attitude only. But attitude really, positive attitude really helps in a way. But if you have positive attitude and you don't have the things that cure the cancer, the drugs or the surgery, because it depends on the type of cancer. Some cancers drug, some by radiation, or some by surgery. So if you don't do any of those treatment options that will really cure the cancer when it's still early, even with a positive attitude, you won't get that cure. Yes. So it's important because it helps. It helps in withstanding, what do they call it? Survival. It really helps. Okay. Yes, but it's not the cure.
Okay, so to put perspective to this now, let's say Mr. A has cancer right now, and he's of course undergoing his treatment and all of that. It's not that what's important at this point is to believe that, that treatment would work for you. Now that's the positive attitude, and not necessarily saying, I believe that, I have faith, I believe that whether with the medication or not, I will get healed soon because I have, so I think that's where it is. So thank you. Yes. All right, like I mentioned a while ago, the theme for this year is United by Unique. Okay. And if I want us to move away from the myth and misconception a little bit and talk more about how people can come together to, tackle this. For instance, I'd like us to take it from the angle of screening. At what point should men, at what age should men, avail themselves of screening for, male-related kind of cancers? What is the age? Because, for people can come together and say, this is a concern to us. When should we go out for screening? Or what, just give me that information, basically.
Okay, so all over the world, most developed countries would have guidelines for screening. But we are working on it in Nigeria. Let me put it that way, because we're all concerned and so many groups are working towards that. But until then, at least we have research that shows, that maybe there's a little subtle difference we should pay attention in our own population because we're Black. So for men in particular, I can't talk about all the cancers, but we'll talk about the most common, which is prostate. Of course. And colorectal, coming up close after prostate for men. So for men, really, screening too right now all over the world, PSA really helps a lot. Different levels, So we encourage men, in the Western world, they say 50. But for us, we're talking about 40 years. Okay, so once you're a man and you're 40... PSA is just simple blood sample. It's not stress, but it gives you an idea of what's going on in the prostate. If it's too much high, then we are concerned. And you now have to see a doctor, like what's going on. But at a certain level, it's fine. That means your prostate is just secreting what it should. Once it's abnormal, there's little concern. Too high, you really are concerned because it has been shown to say that the level of PSA, that is an antigen, prosthetic specific antigen, so it's specific to prostate. That level will show you whether there's something happening, cancer or maybe excessive growth of cells. Yes, so that's why we use PSA.
And you're in Nigerian for
40
instance,
years.
40 years.
Please do it every year.
Just
once
year.
a year.
Oh,
Once a year. Just take a blood test in a reliable lab or go to the hospital that you can trust and take that. That's it.
Okay. So
and keep checking it every year.
Every year, as long as you live, by the way. So you talk about colorectal cancer too.
Now, colorectal cancer, yes, it depends. In the Western world, you have some kind of test that they do before they decide whether they'll do a colonoscopy. A colonoscopy is like using a tube to visualize what's inside the colon. Now, this comes with some people have a high risk for colorectal cancer. There are some growths that they have in their large guts because colon has to do with the large bowel. So if they have those growths, means they have to start colonoscopy early. There they would also say 50 years every 10 years, but here we're looking at 40 years and maybe even more regular than that for a colonoscopy. So everything depends on family history. Cancer is not like a blanket. Whatever it is, I think if people have concerns, especially if somebody in your family has had that particular cancer, please, it's good to start early, seek for help, go to teaching hospitals because they have the experts and get some advice. They'll tell you exactly when you screen. It's tailored to you, but generally 40 years too.
Okay. Yes. Now, because this is a program for women, we can't ask a question for men and not include the women. Sure. So specifically, I know the last time you came here, you really talked extensively about breast cancer and all of that. So you gave some insight, breast examination, self-examination and all of that. But generally speaking now, for women, when should they begin to go for screening of whatever kind of cancer you want to let us know now? Okay. Or what age?
So for women, we're talking about two huge cancers, breast being most common and cervical. So we'll start with the breast as usual. The screening method, a gold standard for screening, is doing the mammography. Because of the changes that occur in the breast for women, mammography ideally starts from 40 years.
Okay.
So in the Western world also, they'll talk about 40, 50. You can do two or 3 years apart. Here, we really encourage women from that 40 to start doing their mammo, at least every 2 years. Then after 50, you can now be doing every year. So there are certain things that for making that decision, we can't go into that detail. So, but for cervical cancer, screening used to be pap smear. Now the world has gone HPV, but HPV is very expensive because it's like checking an antigen or so. You're checking for the causative, that's human papilloma virus, HPV, has been linked to causing, this is one of the things that have been linked to causing cancer. So testing for it helps to know whether there is the presence of cancer or early stages of cancer. So that's more superior to pap smear. But pap smear still is great because you look at the cells. So you get is a smear, and then you look at it histologically. So we still use it because it's cheaper and it's more available. So women here are asked to start reproductive age group, looking at 20 years, 21 years, yes. Start doing it every 3 years.
Wow.
Some places where HPV is available, you can do that. HPV and the pap smear every 5 years. So it depends on the different protocols, but here definitely every 3 years, please. Go and get yourself screened.
Okay, as we wrap up now, that's another popular question I think I skipped earlier. Are there vaccines that, speak to cancer? Just like other ailments, other, diseases, we hear that once you take the vaccine, you, of course, protect or prevent yourself from coming down with, the sickness. So is that the case? I know, apart from HPV that you mentioned, are there vaccines really that would help you stay cancer-free?
HPV has that strongest advantage. It has two advantages. One, the cervical cancer takes a long time to happen. That's one. It could take up to 10, 15 years for it to happen. From when you get exposed, if it will happen, it does take that length of time. And then the virus can be cleared early. And then it now has the advantage of the vaccine, just like you mentioned. Having that vaccine why we go for as early as 9, 10 years or early teenage, is that this is when you're sure they are no longer they are not yet sexually active. So no introduction of the possibility of getting the virus, because that HPV is gotten mostly from sexual activity. So you want to catch them young. In developed worlds, they are not catching just the females now, because some people think it's something against reproduction. But there they do both the girls and the boys are vaccinated.
So availability
yes,
of
because
this.
why keep vaccinating the ladies and then the men will get the infection and still give it to them
Back, yeah.
when they are now much older. But that's one beauty about cervical is the HPV vaccine. It does that, so it increases your immunity. So even if the virus, you do get in contact with the virus later on when they get sexually active, it automatically gives them immunity against any effect. The other one is the hepatitis B.
Okay.
So the HPV, we start from even infants to give that
yeah.
vaccine. So it's really good. These two also have protection.
All right. I mean, thank you for this vital information. So as we finally wrap up, I mean, it's World Cancer Day. I'd like you to just leave a word of advice, a message of encouragement, you know, just to mark this day and the work that you do and other colleagues around the world.
Okay, my message is that we don't have to be afraid of cancer. I know we have limitations in our environment, but we can do certain things. I think prevention, as they say, is better than cure. So the things that we can do for ourselves, let's try and do it. Do whatever it needs, get the necessary knowledge, do what it takes to take yourself for all those screening exercises. Don't be afraid. Better that we catch it early, if ever it will occur. Because once it's caught early, cancer can be cured. And that's my message.
Thank you so much. I mean, I was going to clap if not for this flag in my heart. Thank you so much, ma'am. And we'll be having a discussion with Dr. Ngozi Dim, who is a senior lecturer, College of Medicine, UNN, and also consultant radiologist, UNTH. And I mean, she's done an amazing job debunking all of these myths. And I'm hoping that you've learned something and you will help spread the right information. My name is Doris Mayum Shishe. Thank you so much for being a part of the show. See you some other time.